tumor. A spinal tumor is an abnormal mass of tissue within or surrounding the spinal cord or spinal column. Spinal tumors can be benign or malignant. So let us have a brief look on anatomy. While taking a spinal cord, the cross section, we can see the H-shaped grey matter inside and the white matter outside. And the white matter spread outside, it is divided into anterior column, posterior column and lateral column. The lateral column will have a lateral corticospinal tract, lateral spinothalamic tract. And the anterior column has anterior corticospinal tract, anterior spinothalamic tract. The posterior column involves fasciculus gracilis and fasciculus cuneatus. And the grey matter inside, which has an anterior horn, lateral horn and posterior horn. The classification of spinal cord tumors, they classify the spinal cord tumors based on region, based on origin, based on location. The region means they said cervical tumors from C1 to C8, thoracic tumors from T1 to T12, lumbar tumors from L1 to L5 and sacral from S1 to S5. Based on location, they classify it as intradural extramedullary, whereas the tumor is located inside the thin covering of the spinal cord, the dura mater, but outside the actual spinal cord. So this membrane is called as arachnoid membrane. Some examples of intradural extramedullary tumors are meningiomas, scaveomas and neurofibromas. And intramedullary tumors. These tumors grow inside the spinal cord. They typically derive from glial cells or ependymal cells. So they are found throughout the interstitium of the spinal cord. Some examples of astrocytoma and ependymoma. And lastly, extradural tumors. This tumor is located outside the dura mater, which is the thin covering surrounding the spinal cord. Then based on origin, they divided the spinal cord tumors into primary and secondary. So the primary tumors are originated primarily from these bones, disc, nerves or other elements within the spine. Some examples are hemangioma and osteosarcoma. Whereas the secondary tumors are metastatic tumors, and 90% of spinal cord tumors occurs as secondarily only. Causes. The cause of most primary spinal cord tumors is unknown. However, exposure to cancer-causing agents, people with compromised immune systems, and people with familial history or genetic component were considered to be a cause of spinal cord tumors. In small number of cases, primary tumors may result from presence of these two genetic diseases called as neurofibromatosis 2 and von Hippel-Lindau disease. The pathophysiology of spinal cord tumor resembles the similar pathway as we saw in brain tumors. Symptoms of non-mechanical back pain and loss of sensation or muscle weakness, stiff neck and stiff back, pain and neurological symptoms such as tingling and difficulty in walking, and the patient experiences frequent falls, decreased sensitivity to pain, heat and cold, loss of bowel and bladder function, scoliosis and other spinal deformity may also be visible. And depending on the location and type of tumor, the other signs and symptoms can also develop, especially as a tumor grows and compresses on the spinal cord. The nerve roots, blood vessels or bones of the spine may also involve. The spinal cord can get compressed either anteriorly, laterally, posteriorly or centrally. So based on the compression or based on the distribution of the tracts of the spinal cord, the symptoms vary. Like as in spinal cord injury, the Brown-Séquard syndrome, anterior cord syndrome, posterior cord syndrome and central cord syndrome. These spinal cord tumors may also affect the region wise, like cervical region, thoracic region, lumbar and the sacral region. When the tumor affects the cervical region, the main functions like diaphragm, deltoid muscle function, biceps function, wrist extensors, arm rotators, triceps and finger flexors will be involved. When the tumor involves thoracic region, the chest muscles and abdominal muscles and muscles in the back are affected. When the tumor involves lumbar region, hip muscles, thigh muscles, knee muscles and ankle muscles are involved. When it involves sacral region, the bladder and bowel function and sexual functions are most commonly involved. And the diagnosis of brain tumor involves a thorough medical examination with detailed medical history, dermatome, bladder and bowel function, mobility and activities of daily living. Following the medical examination, the radiological tests like X-rays, computer tomography, magnetic resonance imaging and bone scan will be taken. Treatment involves non-surgical treatments and surgical treatments. The non-surgical treatments, as we saw before, chemotherapy and radiation therapy. In spinal cord tumor surgical management, it involves decompression using a complete or partial resection and stabilization of pathological fractures. So multiple levels can be decompressed and a multi-level segmental fixation has to be done. And spine stereotactic body radiotherapy (SBRT) is in combination spinal epidural decompression is an evolving surgical approach for spinal cord tumors. The rehabilitation of a spinal cord tumor patient, the main goals is to prevent further complications, to achieve maximum restoration of function, optimizing functional capabilities, and improving functional mobility, train bladder and bowel, and environmental modifications. Role of physiotherapy. The role of physiotherapy is completely based on assessment, whether it is non-surgical management or surgical management. The common exercises involved are bed mobility exercises, head, neck and trunk control exercises, limb strengthening exercises, transfer practice, balance and gait training, and provision of assistive aids.